Our healthcare workers have been pushed to the brink. We are seeing images like the ones on your screen in hospitals in North Texas and across America. More and more patients being treated for COVID-19. In fact, one hospital in Lawton, Oklahoma, running out of beds and equipment. Doctors and nurses having to make some very tough decisions.
What happens if a bus crashes on the interstate and there are a whole bunch of people who need intensive care?
Then you see all these people that are doing the groundwork. They do more. That's all you can do.
This is what keeps you up at night.
I'm not sleeping very well these days.
Boy, sobering words, as more than 73,000 Americans are in the hospital currently fighting COVID-19. Hospitalizations climbing across North Texas. In Tarrant County, health officials called the situation dire. We're getting over to Daybreak's Chris Ottigi, who is live in Arlington with what our frontline workers are facing. And boy, this year has been rough for them, Chris. It does not seem to be getting any better right now.
And Mark, we spend a lot of time talking about the total number of COVID cases, but really it's the hospital space that is the barometer that dictates a lot of the decisions. And with some of that space running out, we could see more restrictions coming. 73,000 people across the nation are hospitalized with COVID-19. That is a record high. Beds are running out, equipment is running out, and the healthcare system is being pushed to its limit. Here in North Texas, the 19-county area is at a 14.39%, according to Tarrant County Health Director Vinny Tenasia. That is as far as the number of patients occupying beds. If it reaches 15% for 7 days, it's supposed to force bars to close and other businesses to go back to 50% capacity limits. That's according to the state order. But in Tarrant County, they say the situation is so dire. 92% of the county's ICU beds are occupied, a third of them with COVID patients. So the county is asking businesses to voluntarily cut back on their limits or even shut down. Why voluntarily and not a mandate? County Judge Glenn Whitley says they cannot mandate.
We can do nothing that contradicts or tries to supersede what the governor has done. So, in effect, we have no control over much of anything.
And Whitley said that he did reach out to the governor's office for some guidelines, some advice on what the next steps might be, but he says so far he has not heard back from anybody in the office. Kara, back to you.
All right, thank you, Chris. And while you were sleeping, we got big news from the testing front. The FDA approved the first at-home rapid testing where you can get your results right in your living room. It's available by prescription only, and it uses self-collected nasal swab samples. It can return results in just 30 minutes. So the at-home test could be one more step that gets the country closer to normality. Let's get a live look this morning at two of the big airports that are gearing up, Love and DFW, for the Thanksgiving holiday travel season, which, although will not be as big as last year, we do understand airlines are prepping for more travelers this week and next. Hannah Davis live this morning at DFW Airport, where they are trying COVID testing on one route.
Yeah, good morning, Carrie. You were talking about testing really being possibly kind of the opening up factor for society, and it looks like airlines and airports are looking at the same thing. Here at DFW, American Airlines now has COVID tests for at least one route that's going on. So if you plan to fly to London from DFW, you're going to be given a COVID test 72 hours before your flight, one right after you land, and an at-home kit to take 3 days after arriving to the UK. If a passenger does test positive, they're going to be asked to rebook or cancel their travel. The airline says this rollout is an effort to demonstrate how COVID-19 testing can reopen international travel going forward. United and British Airways are both doing similar tests. Now, earlier this month, we did get a behind-the-scenes tour of the cleaning and social distancing procedures at DFW Airport. Take a look at some of the steps. Staff wiping down the self-check monitors throughout the morning, hand sanitizer set up at several checkpoints, and at TSA, staff are cleaning each bin after use. All of this, of course, leading up to the holiday travel season. Both American and Southwest Airlines have said that they're adding hundreds of flights during that time, as many Americans still plan to travel for the holidays. Now, a lot of people have been asking, what is the risk factor when you fly? The CDC says the actual setup of an airplane, the way the air filtration system works, makes it actually rather low risk for COVID transmission. The thing where it gets tricky is when you're sitting right next to somebody, especially a stranger, for several hours. So if you're able to socially distance, or the more so you can, the better when you fly. Back to you.